In Germany, drowning is the second most frequent accidental death of little children. This doesn't only happen to major children in swimming pools or stretches of water. Death by drowning may also happen to little children who are not minded for a moment. There are a lot of possible sources of danger: at a fountain or pond in the garden, in the bathtub, in open stretches of water, in paddling pools, rain barrels, or even a puddle. Because the water level is not relevant. If you detect a drowning accident, save the child from the water, but be careful, don't overestimate yourself. In case the accident happened in deep water, you'd better call a qualified person to save the child. A qualified person is especially trained for cases like this. Don't lose precious time. Check consciousness and respiration immediately after rescue. For this, you keep your head very close to the infant's nose and mouth for about 10 seconds. Should there be a missing of respiration, you commence reanimation for about a minute. After doing so, you make the emergency call. After that, you go on with the reanimation until the emergency medical services arrive. You hold the head exactly the same way for the rescue breathing as for the respiration control. Bring the head into a neutral position and lift the chin with 2 fingers in order to keep the respiratory system open. Breathe in normally, bend down and put your lips around mouth and nose of the infant completely, so that no air can escape sideways. Blow air into mouth and nose constantly for 1 second until the thorax apparently raises. After 5 attempts of artificial respiration, you check respiration again for 10 seconds. Sometimes these initial measures lead to restart of respiration. In case you don't notice a regular respiration, lay the infant down onto a hard ground. Put 2 tips of fingers onto the middle of the thorax. Push the breastbone down by means of the fingers. After each compression, release the pressure completely without losing contact between your fingers and the thorax. Push down 1/3 of the size of thorax with a frequency of 100 times per minute. In a sequence, you make 30 cardiac massages, quickly alternating 2 artificial respirations. The reanimation of an infant or child differs corresponding to size and weight and technique of artificial respiration as well as cardiac massage. In turning the head sidewards, you can get the water out of the child's mouth. When you are not alone, ask one of the attendants to call the emergency and to wait for the ambulance. Keep the respiratory system of the child free and bending the head backwards and lifting the chin at the same time. For artificial respiration through the nose, close the child's mouth and pushing against the chin carefully with your hand. Breathe in normally, bend down and put your lips around the child's nose closely. For the mouth-to-mouth resuscitation, you keep the nose shut with your thumb and forefinger. Breathe in normally, bend down and put your lips around the child's mouth closely. Blow air into mouth or nose constantly for 1 second until the thorax apparently raises. Turn your head to the thorax and breathe in again. By this, you can see if the thorax moves down again. After at most 5 attempts of artificial respiration, you check respiration again for 10 seconds. In case you don't notice a regular respiration, put the cenar onto the middle of the thorax and bend vertically over the thorax. Lift your fingertips in order not to impose pressure on the ribs. Push the breastbone down by means of a stretched arm. You push down 1/3 of the size of thorax with a frequency of 100 times per minute. After each compression, release the pressure completely without losing contact between your hand and the thorax. In a sequence, you make 30 cardiac massages, quickly alternating 2 artificial respirations. You have to absolutely continue the measures of reanimation until the ambulance arrives. When the child starts to breathe normally, you can stop the procedure and lay the child into a recovery position, and it is important for you to keep the child warm. When your child is responsive, calm him or her down. In order to avoid late effects, he or she must necessarily be brought to hospital for an intensive checkup and monitoring. After a drowning accident, the following measures have to be taken. Save the child out of the water without taking a risk for your own health. Check consciousness and respiration. Call the emergency. Keep the child warm. Carry out first aid measures until the emergency medical services arrive.